Hi everybody, Dr. Amy, and one of the most common questions that I get asked as a chiropractor is, Doc, should I use heat or should I use ice? What should I do? And the answer is it's not that simple as a one word, use heat or use ice. It depends on what you're treating. So it's really important for you to go to the doctor, get a proper diagnosis. Because what can happen is if you put the wrong thing on at the wrong time, whether it's heat or ice, you can actually cause potential damage to those tissues. And I'm going to give you an example. One example is that if you recently injured your back and it's a disc problem, and you're not going to know that unless you go to the doctor, have them check you out, have them determine whether it's a muscle sprain, strain, or if it's a disc, or if it's a nerve causing your problem. You need to know, number one, what is the problem? Number two is, how long has it been there? So if it's within the first 24, 48 hours, the rule of thumb is always err on the side of ice. In the case of a disc herniation, you're going to want to always err on the side of ice because the ice slows down the nerve conduction velocity of the nerve that is potentially inflamed due to the disc herniation. Discs don't cause pain. They actually don't have pain fibers, but when they herniate, they can put pressure on the nerves that come out of the spine and irritate them, and that's what causes your pain. And if that's the case, you want to err on the side of ice. If it is a chronic problem that keeps coming back, or if it's arthritis, or if it's a muscle sprain, muscles respond much better to heat. Arthritis responds much better to heat. It's kind of counterintuitive. So make sure that you go to the doctor, get the proper diagnosis, figure out how long it's been there, is it an acute or a chronic problem, and your doctor can tell you whether you should put ice or heat on your problem. The most important thing to remember in the case of ice is never put ice on, never leave ice on for more than 20 minutes. The reason is that when you put ice on your body, it causes temporary vasoconstriction, which helps to decrease the inflammation, decrease the blood flow to the area. If you leave that ice on for longer than 20 minutes, what happens is the brain senses, hey, we need blood flow here. We're going to dilate the blood vessels and we're going to send massive amounts of blood there to prevent you from getting hypothermia and also like frostbite. So it starts to work counterintuitively. So more ice is not better. Make sure you take it off after 20 minutes and make sure that you do not put ice or an ice pack directly on your skin. Always use a towel. So the next time you have low back or neck pain, or you hurt yourself, or you've got an injury, make sure you go to the doctor, get a proper diagnosis to figure out whether you should use heat, whether you should use ice. And all cases, ice will never hurt you. Ice will never cause damage. So you can always err on the side of ice. If you want to be on the safe side, no more than 20 minutes or it can damage the tissue. Same thing with heat, no more than 20 minutes or it can start to cause inflammation and actually cause damage to those tissues. So those are the rules of thumb if you want to follow the next time you have an injury and want to know, should I use heat? Should I use ice? Follow the rule of thumb. And if you have any questions, please reach out to me right here on the Dr. Amy Cannata Facebook page, or you can visit my website at amycannata.com.